Welcome back. This is the 8th part of our series looking at how the United States compares to the rest of the industrial democratic world. Today's episode, we're going to look at healthcare. And I got to tell you, it is not a pretty picture at all. Hi, I'm Dennis Johnson, and I recently completed a major study looking at how the United States ranks in comparison to other democratic industrialized countries in domestic public policy. Things like healthcare, taking care of poverty, a social safety net, housing, watching out for homeless people, things of that nature. Before we get started, if you can hit the subscribe and like button, I'd really appreciate it. One of the major things that happened way back in the Harry Truman administration, back in 1949, at his State of the Union address, he said, one of the major things that we have to watch out for is the health care of Americans. He says, it's appalling to know that so many Americans still don't have health care coverage. That was back in 1949. He tried to introduce a bill back then, but it was totally swamped, called the most socialist thing that ever happened in America by one of his opponents. We didn't have really major legislation at the federal level to help in terms of health care until Medicare and Medicaid came along in the mid-1960s. Medicare, of course, is for elderly people, no matter how rich or poor they are. Medicaid is for people of all ages, and it's for people who are poor or don't have a lot of money. Interesting thing when we're talking about Medicare, there's a lot of stuff going on right now about Medicare. Remember the big, beautiful bill that was passed back in June? Well, one of the things that was stripped out was roughly $900 billion was taken away from Medicaid. Oh my gosh, how are poor people going to be able to go to the hospital, go to receive medicine? How are rural hospitals going to maintain themselves? This bill, basically what it did was take away from the poor and gave to the rich. And there's just no other way to cut it. So Medicaid is a real problem these days, and we just don't know how that's going to be resolved. One of the issues that we find throughout the OECD, those 38 countries that we like to compare ourselves to, is every single one of them has national health care, except for us. We're the only country in the OECD that does not have national health care. We've tried, Senator Bernie Sanders and others came up with Medicare for all, trying to take what we do for seniors and apply that to all citizens, but that hasn't worked out either. One of the problems we see with the problem of medical attention and medical care is life expectancy. How are we doing in terms of the other 38 countries in the OECD? We're 27th. We're the 27th country in terms of life expectancy. How about the cost of healthcare? When it comes to the cost of healthcare, we spend so much money on healthcare. We're number 30 in terms of the OECD countries. Now, the interesting thing is, we have some of the best doctors and some of the best hospitals in the world, and people flock here from abroad to get help from doctors and specialists. But we also have this extraordinary problem of rural health care, which rural hospitals are closing. There are hospital deserts throughout the country rather, and it's a real problem in the United States. So what we find in altogether is the United States it's shameful that our healthcare system is ranked as the 38th in the world, 38th in the world. And I'm appalled at this, and I assume that you are too. Now, we'll talk about other things next time around, but before we get any further on this, you might want to check out my website, www.we'renumber.one, we're number one, which basically looks at what the Trump administration has been doing in its second term. I also have my book, which is called We're Number One, and also a Substack newsletter also called number 1. And you can see this down in the description below. Thank you very much for watching, and our next topic is going to be crime, firearms, and punishment. Thanks a lot.